the electrical signals of the heart stop working. It can't beat as quickly or as fast as it should. And there's just like this internal pace that just keeps it going. A typical baby is like 130, beats per minute. And Renee's heart rate was like 55. And I can't hide, 'cause growing pains are keeping me up at night.
Hi everyone, welcome back to this week's episode on Take a Pain Check. I'm so excited to have Emily joining me today. Hi Emily, can you give me a brief introduction about yourself? Tell me a little bit about your education, your career, and what you've been up to recently.
Yeah, hey Natasha, thanks so much for having me. My name is Emily. I am 33 years old. I am from the New Orleans area, but I currently live in Laurel, Mississippi. And I really enjoy, well, first of all, I'm a physical therapist, and that's something I truly love to do. I went to college at LSU and then went on to PT school in Austin and really enjoyed my time there. But more recently, I've slowed down a lot and just really got to doing things that I enjoy on my scale, on my time. I love to cook and try new recipes. That's something that's actually quite relaxing for me. And then I'm always listening to music or definitely have candles going in every room. And I really, really enjoy a good cup of coffee. So yeah, lately I've just been taking it slow and doing the things that I enjoy doing.
That's amazing, and I'm so glad that you're kind of
Yeah,
prioritizing yourself because I know life can get busy and sometimes we get too caught up in like work or school or anything else that we don't really think about ourselves. But so it's nice that you've come to the realization that you need to like focus on yourself now. You're on this
absolutely.
podcast because you have a diagnosis of a rheumatic disease, maybe a few, more than one, and a couple other diagnoses, which we will get into talking about. So can you tell me a little bit more about, I guess, what your diagnosis is and when were you diagnosed with these conditions?
Sure. So, I was diagnosed with juvenile rheumatoid arthritis when I was 4 years old. Now, people refer to that as JIA, juvenile idiopathic arthritis. And over time, that has kind of morphed into other different types of autoimmune diseases. So, I spent the majority of my childhood with joint issues and eye problems called uveitis with inflammation in my eyes. And then as I kind of became a teenager, that morphed into Sjogren's syndrome. And then as I became more of an adult, I developed some other complications from Sjogren's. Pulmonary arterial hypertension is one, lupus is one, and then a kidney disease called FSGS. So my kind of rheumatic autoimmune disease has been across the spectrum throughout my entire life, essentially.
Wow, you have been through a lot. And I'm wondering because there's so many different types of conditions and they manifest in probably similar but also very different ways too, kind of impacting your whole body from what it sounds like. How did you navigate how to differentiate the condition? And you also probably take lots of medications. So how did all of
Yeah.
that work for you?
Yeah, it's not easy. And I'm still like learning about different symptoms that can happen, different other diagnoses that can come from others. When I was a child, I mostly had swelling and pain in my knee joint, just one joint it affected. And then throughout my like entire chronic illness history, I've always had more systemic issues. So like it affected more of like the insides of my body, the connective tissue, the organs and things like that versus what you really saw on the outside. So for a lot of my life, I looked perfectly normal, so to speak, on the outside, but inside my body was just going havoc. Attacking each other. So I've been on a lot of different medications, pretty much everything out there. I started with methotrexate injections as a child. They had pill form and injection form, and that's a medication that many people with rheumatoid arthritis take to help kind of calm down the immune system. I've taken Humira, which is another self-injection, Enbrel, another self-injection to kind of serve the same purpose. And then at one point I was taking Remicade, which is an infusion medication. And all of those always led to different types of side effects. And they felt like they never really helps get at the underlying cause, but sometimes caused more damage than good than what they were intended for. Um, it took me a really, really long time to figure out how medications work, what works for me, how to take them, and things like that. And more frequently, I'm on something that maybe some people with lupus are familiar with. It's called hydroxychloroquine or Plaquenil. And that's a pill medication to kind of serve the same purpose, to kind of lower the disease activity in my body. And then also Benlysta, which is another pretty common lupus medication, and that is an injection I have to give myself as well. And then I have a slew of other like pulmonary hypertension medications that we can go down that road, but there's a lot of them.
I relate to you so much because I also had that struggle of not being able to find a medication that worked for me and just constantly the trial and error of figuring out what works for you. And then for the longest time, just not being on something that works, but trying different ones. It's frustrating and it does impact also your mental health on top of that physical well-being aspect of it. So I'm wondering what was going on in your mind when you were constantly going through a bunch of medications.
Yeah, it's really frustrating, right? Because you finally get like a diagnosis and then you get a medication and then they're like, okay, well, it takes at least 3 to 6 months for this medication to work. So now we're like we're in the waiting game. And then it's like, okay, well, now 3 months have gone by and I don't really feel much different. It's like, okay, well, we really just haven't given it enough time yet. So it's like almost a year you're going on different treatments to different treatments. And it's really a struggle to know like what's working. And all of the majority of these treatments happened in like my childhood and then into my teenage years. And that was not my priority. I was just like, whatever, I have to take this medicine so my knee doesn't swell so I can go play soccer. So whatever, like, it was not until I became much older and obviously more mature to understand what was happening to me, to take more incentive as to what I was doing and what kind of medications I was taking. For a long time, I was on prednisone, which is a steroid that I'm sure many people have been on. And that really was taxing for me. I mean, the side effects are horrible. Nobody tells you that your face is going to be so swollen, it's unrecognizable, and you gain so much weight and it's uncomfortable and you're hungry and tired and angry just all the time. And, my body loves prednisone, unfortunately, and I kept going on and off and on and off. And I'm like, I can't do this anymore. So that is set my foot down and was like, no, this medication I will never take again. I don't care. Give me something different. But it's a really, really hard journey to navigate. And I feel like it's a lot of trial and error in research. And I think having a community of people to ask questions to who have been on medications, learn from other people, I think that's the best bet. And, leaning on those types of resources versus more like doctor experience or scientific research or something like that. The community is really what helps you figure out, what things work for certain types of people.
And because you were diagnosed during childhood as well, can you talk a little bit about your childhood growing up with
I
arthritis?
feel like I have like a core memory of like the first time that I ever felt like I was different and limited in a way. I was in preschool and we all had to like sit in a circle and our teacher would like read or teach us or whatever. And for the first time I couldn't sit with my legs crossed because my knees were just so swollen that they couldn't bend in such a way. And so my teacher was like, Emily, you have to cross your legs. Like someone's going to trip over you. And I'm just like, I can't do it. And that was like my first reality of like, I'm different than these kids. But I grew up and I played a lot of sports. There were times where I had to like miss school, practice for doctor's appointments, or because my knee was just too swollen, I had to sit out of things at times. But I never really let it limit me. And I had really good parents who supported me and made sure that I didn't feel different from the other kids. They still let me try whatever I needed to try. My mom a little bit more cautious than my dad, but they always still pushed me, and I didn't want to seem different either. So I just pushed through things just to feel more normal in that regard. But yeah, and then as I got older, when you're a teenager, that stuff doesn't matter anymore. You just want to be with your friends and fit in as best you can. So I kind of just did what I could with what I was given.
I'm kind of wondering what joints were impacted for you, and did that make a difference in like the different activities you could do as a teenager or someone that went to college? And I guess, your social life? Because I feel like depending on what joints may be impacted, your social life may be impacted as well. So how did that work for you?
Yeah. Mostly I only had one joint that was inflamed, and that was my right knee. And ironically enough, like I played soccer and I ran cross country in high school and managed to still do those types of activities, even, when my knee was doing well. If it was flared, I couldn't participate in those types of things. And then um as I went in college, I had another pretty significant flare. And this affected my knees and both of my ankles. It was bizarre. I had never had these symptoms before. And I remember walking up to one of my classes at LSU, and I had to walk up this like really tall hill from our parking lot. And I was limping so bad. I could barely even walk around campus. And this sweet janitorial man was riding his golf cart around. He's like, "Are you okay? Do you want to ride?" And I was like, "Please." So he picked me up and brought me to class. But it was really hard on those types of days to just kind of feel like, gosh, when is this ever going to be behind me? When am I ever just going to be able to be normal and to just walk and not have to worry about um, you know, doing the things that normal college kids are doing at this point. I'm walking around, we're a big football school and like walking in the stadium, going up the stairs, going out with my friends, trying to find things to do. So it was really difficult in that regard. I tried to push through as much as I could, but some days, just had to say enough is enough. But fortunately, kind of at that time also was when I was transitioning kind of out of the JRA and more into the Sjogren syndrome. So it was less arthritic issues and more kind of internal things going on that I was actually just learning to figure out.
How do your appointments look like? Because you have JIA, lupus, and Sjogren's plus other healthcare conditions. How do you navigate a rheumatologist appointment, for example? And it's so different because for me, I'm like, I don't have enough time to talk about one condition. How do you have time to talk about
Yeah.
like three conditions and more?
Yeah, it's very difficult. I have a great rheumatologist, and I have seen several different ones throughout my years. I was so upset when I had to actually move from a pediatric to an adult rheumatologist. I was like, what am I going to do now? I have to like navigate this on my own. And it used to be pretty straightforward. But then as the diagnoses continued to grow, it was really hard to fit, everything in one go. And I feel like I'm not the only one that's done this, but it's also like, let me just try to figure out what's the most important thing that I need to talk about at this appointment. One, so they'll actually address it and they won't think I'm just like rambling off a bunch of symptoms. And then they'll be like, okay, whatever, she's, just feeling all these things or whatever it may be. I'm like, let me just try to get the most important point across. But it's really hard with rheumatology because everyone, presents so differently with these type of illnesses. And it's hard to know like if what you're getting is the correct treatment. It's really important to feel like you're heard and you're able to communicate those things. I see my rheumatologist used to be like my primary care doctor. Like I would go to him for everything. And then he would send me to like a lung doctor or a kidney doctor. And then it's like they would send me back to the rheumatologist and be like, well, this is your autoimmune condition causing this. And he's like, well, you need to see the lung. I mean, it was so hard to get everyone to communicate on the same page. It's really difficult. But now we kind of go in with like a review. We're like, okay, let's see, how's the lupus doing? What are you feeling? How's your joints? Do you have any swelling? And then we kind of go, how's the dryness with your eyes, your mouth? How's your kidneys doing? We kind of go through each organ system or each condition and go from there. I try to, and I'm about to like have a whole series about this, but I try to, get all my doctor's appointments together. So they're within the same 2 week span, month span. So everything's kind of easily accessible. So they can, go pull up my kidney doctor's notes or my pulmonologist notes, my lung doctor or something like that. So I try to make sure everyone's in close communication with each other. And then just make sure everything is touched on. And I think it's important with the longevity of doctors as well. If you have that good history with them to be able to, they already kind of know, how your body responds to certain things, and kind of what your important goals are. It's really important to discuss that as well.
I'm glad that you're able to kind of optimize what that appointment looks like. And so you're trying to get the best out of it because I do find that even with one condition, sometimes it's hard to make sure that there's enough time to talk about everything you need to, but making sure that there's sort of structure and you're also prepared, I think is really important. I mean, nowadays I kind of write down before my appointments what I need to talk about. Before I heard people do that and I was like, why would I do that? That's such a waste of time. But then once I transitioned from like that pediatric to adult care, I only have like 20 minutes. This is all I can
Yeah,
talk about. So really just
right.
be prepared. I also find it hard to even get appointments sometimes, right? So making sure that you optimize your time with your doctor, you make sure that it's very efficient and an effective manner you're talking with them would be, I think, the most ideal for anyone living with a rheumatic disease. At the beginning of the episode, you did mention that your career choice was to be a physical therapist. I'm wondering if growing up with arthritis kind of led you to pick that career.
100%. 100%. Yeah, I knew I wanted to do something in the medical field because I was so intrigued with like what was going on with my body every time I lived in doctor's offices like my whole childhood and still do. And so I was always so intrigued. I wanted to know what was happening, why it was happening. I was like, I need to know more about this. And I really wanted to go into the medical field. And I think it was more of my involvement in sports that brought me along to physical therapy. And just having arthritis 100% definitely brought me there once I found out what that career was. And I really do love it. And there was a point in my life just recently that I thought I would never get back to this. And it was so devastating. It was like, felt like a piece of me, was died and buried and would never come back. And so I was able to get the opportunity to do remote care now. So I do more telehealth, and that's more convenient for my schedule, my symptoms, things like that. But most importantly, I really wanted to be a physical therapist, and I've learned this even more so, as my different diagnoses progressed. Is I really enjoy helping people feel heard and understood. Pain is such a hard thing. Everyone experiences it so differently, and it's taken so many different ways. And it's such a hard thing. And I feel like for people who I treat who have different chronic illnesses, autoimmune diseases, it's really encouraging to know that someone knows what you're going through. Someone can understand, and it's kind of like a weight lifted off your shoulders. So I really enjoy helping people highlight and find their abilities and what they're able to do and focus on and function versus only looking at strictly the limitations that they have, and kind of honing in on trying to fix things that we might not be able to solve ourselves. And so really helping people feel comfortable with exercising and knowing what their bodies are capable of and appreciating the mobility that they still have, no matter, how much that may be.
Did you go to physical therapy as you were growing up with a rheumatic disease, and do you think that also influenced your career path, or did you not go at all?
I never went once, surprisingly, not once. And
Okay.
I always wondered that. I'm like, why didn't they send me to physical therapy? Like, I was a pretty active kid with a rheumatic joint condition. Like, why didn't anyone ever send me there? But I did not.
A lot of people that live with conditions either kind of go in two different pathways. I've seen like people that I talk to, it's like they really, when they're diagnosed with arthritis, want to keep that sort of, I guess they use arthritis as their inspiration to whatever their career wants to be. And there are the other people that are like, I don't want anything to do with arthritis when it comes to my career. So I've seen both ends of that, but I think they like to still make impact in other ways. So it's just interesting to see that your career path is really just based off of your own lived experiences, but you never went to physical therapy, which is a little bit shocking.
Yeah.
So,
Yeah. Yeah.
oh, that's great. And I mean, you lived with these conditions for a very long time, basically all of your life. So you've never actually known life without arthritis. Would you say that?
Yeah, absolutely. And that's what it was really hard for me. to figure that out, like, I don't know any different. Like, I don't know what it's like to not be sick, um, to not feel like, it takes me a while to wake up in the morning sometimes. Like, I didn't know any different. And so that was really hard for me, actually, when I had to navigate new diagnoses and new illnesses. Like, I just became so used to living a certain way that I didn't know I was getting sicker as I was getting sicker, because I'm like, this is just life. I have to get this blood work done. I've always done it my whole life. I have to get these types of tests. I have to, give myself medicine. I have to make sure I take it. I mean, it probably took me, I mean, it did take me a long time to get used to those types of things. It wasn't until I was probably 30 years old, which was very recently, that I gave myself my first injection. Like, it took me a long time to get used to those types of things. But, yeah, it was really hard to recognize. I kind of had like a wake up call, like, okay, people don't live like this. I need to talk to my doctor about these symptoms that I'm having, because, it might be something else. It might be able to be treated. I need to feel better, and I have the opportunity to feel better. And it took me a really, really, really long time to figure that out.
I can totally see that. And as you've kind of grown up with this condition, can you talk a little bit about navigating relationships with arthritis?
Yeah, absolutely. It was never something I was always like self-conscious about it. I was always, like you mentioned, walking slow. My friends to this day will always tell me I walk, I walk slow, and now I'm asking people to slow down. But yeah, I was always a little bit worried. I never really brought things up. I never really, like as far as like romantic relationships, I like steered clear of that, just because I was, one, busy and occupied with other things, but two, I didn't want to have to like explain, like, oh, I'm sick. I have to give myself injections. I have to do this. Like, I have to go to the doctor every other week. Like, that was difficult. And then also, you pick and choose the people that you have relationships with. Like, my friends understood. They asked questions. They supported me. They looked up stuff online. They, were concerned for my wellness and things like that. And then, my family is definitely 100% supportive, and they're there to help me if I need them to bring me to a doctor's appointment or something like that. Will always do that for me. And then, as far as, I met my husband now back when I was in college, and we knew each other for a while before we started dating. So I felt more comfortable just like sharing, like, hey, this is what's my life. This is reality. This is what it looks like. And when we got married, I got married in 2017. I was actually, probably the healthiest I'd been in a long time. So I felt pretty comfortable. And then, as things changed, I got sicker of recent, after my pregnancy, and my husband really stepped up to help me there. And I think knowing, that you have at least one person on your team that can support you, and just be honest and have the conversations, like, look, this is my life. Things may get better. Things can drastically get worse. But I've learned that, he hears my phone calls. He sees me in pain. He knows what goes on day in and day out. He watches me inject myself, take medications, feel uncomfortable at times. And, he comes to doctor's appointments with me periodically, if I ask him to. And, he is not afraid to ask the hard questions. He's not afraid to tell people no. So I'm really thankful, that I have someone like that, on my team. But in the beginning, I was so self-conscious of, not only my like limping around and arthritic issues, but also my Sjogren's issues. My mouth was always so dry. I was so afraid that like my breath stunk all the time. I mean, it was really hard to feel comfortable with who I was and what was happening to me, kind of when I was in that like prime area of my life.
Is there certain ways that you told people that you had arthritis when you were kind of in the stage of dating?
I didn't really do it that often. I feel like I became friends with people and would like slowly like say, oh yeah. I mean, it was not something that was brought up unless it was like witnessing me, taking medication or something like that. And I never really dated a bunch of people before, I met my husband, but, I would not ever bring it up unless, unless it was something like in the act happening to me right now. I really didn't mention it. I didn't want to seem different, I guess. I was, like I said, I was pretty self-conscious in that area of my life, just with all the different things that was happening to me. And I didn't also make it a priority. Like I just wanted to be a normal college kid. So I didn't really, mention mention too much of it unless I absolutely had to. And then once you feel the right people around you, you're like, okay, I can open up myself and be vulnerable here and let them know what's really going on with my life. And then kind of like what my, how I need to be treated and things like that.
Yeah, that makes sense. I also find that I feel like you don't have to tell every single person you have arthritis, and like
Yeah.
if it's the most like if I find myself like if I need something or I think it's very important that I will, but I just don't find the need to like be like, hey, I have arthritis to like everyone anymore. Or I mean,
Right.
I never did, but I just feel like more people knew about it than they needed to know. Um,
Yeah.
so totally agree with that. And you kind of also mentioned like different ways that your partner supports you. And
Mhm.
you now have a family. So how do you how did you navigate like parenting with arthritis?
Um, it was very, very difficult. So, I became I'll talk a little bit about my pregnancy first, if that's okay, because that was really when I became super duper sick. And I thought, like I said, I thought I was the healthiest person in the world. Um, when I got pregnant, I made this goal with my doctors for years before I got pregnant. Every specialist, I was like, I want to have a child one day. I need to be on the medications that will allow for that and that will support that for me. And so, because there's a lot of them, methotrexate being one, you can't have children on that type of medication. And I needed to make sure what I was doing was supporting my body enough to be able to not only protect me, but also my child. So I was 30 at the time. And like I said, I thought I was the healthiest I'd been. I was pregnant, and then my first trimester went great. I started to get this lupus rash all over my body. I didn't know what was happening to me. It was the first time I experienced that. And then I started to get really sick really fast. My legs were super swollen. And I didn't know what was happening to me. I had so many symptoms that I've never experienced in my life. Like each week was like riding a roller coaster in the dark, not knowing what was going to happen next. And I don't think anyone on my health team, I don't think anyone could have predicted the series of events that unfolded. But everyone's like, oh, when you get pregnant, your symptoms subside, your arthritis is better. And then really it was the exact opposite in my case. Everything got worse and to an extent that, led me to be really sick really fast. And when I was 22 weeks, my daughter Renee was diagnosed with something called heart block. And I didn't know this was a chance to happen before I got pregnant. I didn't find this out until I was meeting with like a maternal fetal medicine doctor. And they're like, oh, by the way, your child can develop this. And heart block, what happens is the electrical signals of the heart stop working. So it can't beat as quickly or as fast as it should. And there's just like this internal pace that just keeps it going. So a typical baby is like 130, beats per minute, and Renee's heart rate was like 55. So that affected, how she grew and things like that. She would need to get a pacemaker. And this happened because in mothers with Sjogren's, they can pass antibodies to their children, and that causes heart block. I had no idea. I had no idea this was even
Yeah,
a thing.
what? I'm listening to this for like the first
Yeah.
time.
So like no one, and like I said, I talked to my doctors for years. Like this is my goal. Not once had anyone mentioned it to me, and I didn't think anything of it because I felt great. I didn't feel the need to like scare myself and go down a rabbit hole of searching things on the internet about people with autoimmune conditions and pregnancy. Everyone responds so differently. So, yeah, I had no idea. And that was a really big shock for us. And then I continued to get sicker. She continued to get sicker. And then she was born, through an emergency C-section at 26 weeks. And then as she was born, she spent 8 months in the hospital. And as she was born, or as she was in the hospital, I was getting sicker on my end as well. And I found out so much I had so many things happen to me and so many things were revealed as far as like symptoms and diagnoses. And I'm like, I I didn't know like all this stuff went just misdiagnosed, undiagnosed before I became pregnant. I had so much like chest pain and shortness of breath, and everyone's like, "Oh, that's just Sjogren's out there." It can do that. It can flare up your connective tissue of your lungs. And I had all these tests done, and then it turns out it wasn't that. It was something more serious called pulmonary hypertension, where the blood vessels of my lungs are restricted and I can't get as much blood flow and oxygen to them. And my heart was failing. I mean, it was a disaster. So I know, I'm sorry, this is like way off topic of your question, but
I think this is so
yeah,
important for people
it
because
is.
I wouldn't have known that, and a lot of people maybe with Sjogren's, for example, may not even know that this is a thing. So I really
Exactly.
appreciate.
I had no idea. I didn't know what pulmonary hypertension was until actually my daughter was diagnosed with it in the NICU, and then they were telling me all about it, how serious it is, and then like literally 2 months later, I'm being diagnosed with it myself, and two different forms. It wasn't like a genetic thing. That's common in NICU babies, but I mean, it was scary, and I was getting sicker and sicker and trying to manage kidney appointments, long appointments, figuring out what the heck was happening in my life, and also trying to be there for her and advocate for her in the hospital every day as well. And then, kind of long story short, at the end of the day, it's like, oh yeah, your Sjogren's syndrome, that can cause pulmonary hypertension. So can lupus. Like, yeah, like you didn't know that. It's like, I had all these tests done, and hindsight is 2020. Like I look back and doctors are like, yeah, you had it back then. You had it back then, 3 years before you got pregnant and had the echo done that showed this. Like, yeah, it was evident that you had this whole time. And it's like, well, if I would have been diagnosed, I mean, I was too busy and I was too happy to be sick. Like I was just listening to what doctors were telling me. I didn't know any better. And like I said, in the beginning, from the outside, I didn't look like anything serious was going on. So I was pretty healthy. I was a physical therapist. I was exercising and thought I was just out of shape because I was short of breath all the time. And turns out it was something like significantly more serious than that. And it's pretty rare. It doesn't happen to a lot of people, but it happened to me. So it's possible. But yeah, that's something I had no idea that came into my life so dramatically and would have made a huge difference in my life, in my lifestyle, had I been diagnosed sooner. My daughter, Renee, she passed away in February of 22 when she was a little over 8 months old. She had just gotten out of the hospital and home for the first time. And then became pretty sick pretty quickly. And so that was, had I known all these things beforehand, would I have done anything different? Maybe not, but because that brought me Renee. But it was definitely an awakening and a really, really low time in my life where I felt like I didn't know my body well enough to advocate for myself, to make these symptoms. I mean, I had no idea. I wasn't given the education, but I also didn't seek it out either. I put a lot of blame on myself for not knowing something more serious was going on because again, I've lived with chronic illness my whole life. Like I don't know anything different. And then it wasn't until the series of events that made me realize, okay, this is not normal. People don't live this way. Like I need to be more vocal for myself. I need to do more for myself and then, kind of be more in control in what I need and what my medical needs are, versus relying on other people to tell me, what's going on with me and what I'm supposed to be feeling and what might be happening. Um, the hard thing is with living in autoimmune disease is that it's always blamed for everything, but that's it. It's just like an easy scapegoat cover up. Like it's hard to get to the bottom of things, especially with arthritis. Like I feel like people have different joint issues, but also it affects your internal organs and your systemic body as well. And it's like, if your joints are okay from the outside, it still matters what's going on the inside as well. And so sometimes I feel like that can be overlooked, in different areas.
Wow, that's a lot.
I'm sorry.
I know. I'm so sorry that that happened to you. I feel like you never anticipated that to even happen in your life. And honestly,
Yeah.
you're not the person to blame because you had no idea. And if you had more education about it, you may have taken more precautions, but also you can't do too much about what happened. So, what is something that you can say to like other people with Sjogren's?
Um, I felt pretty confident and like I said, hindsight's always 2020. It's so easy to look back and see the things that you could have done. But um, I would recommend getting like an extensive amount of blood work done. So the way to prevent heart block is to take Plaquenil, and that's the one method they give moms to take to prevent this. And it's very rare. It's like a 1% chance that this could happen. And I was already on this medication for several years, so nobody was worried. But one thing I would see like try to measure the disease activity in my body. Like, what do my antibodies look like right now? Am I on the best medications? And then I would also consult, there's something called a maternal fetal medicine doctor who manages mom and baby with high risk type of pregnancies. And I would consult them, prior to and just saying, okay, what are my risks? What are things that potentially can happen? What do I need to do for myself? And you can still do all the right things and then something still happens. But I feel like if I was just a little bit more educated and aware of what was going on with my body, I think I don't know that anything would have changed, but I think that that's some good advice just to check in with everybody, every single person on your care team, and consult, what it would look like once you're actually pregnant with different types of doctors, if that's accessible to you.
Throughout your pregnancy, like what medications were you on?
Um, they love to tell me that it was because of my Sjogren's that this was all happening. They love to remind me of that every day. That was really, really hard. Not only hard to know that what was affecting me was now going to affect my child. That was really, really difficult. But also at the time I was taking Plaquenil. That was like the only medication I was taking, significantly. I had to take a blood thinner. That was the injection. I had to take that twice a day. I had to give myself an injection twice a day. I had a history of blood clots in my lungs in the past. And so I took that prophylactically to make sure I didn't get any new ones, because that's pretty common with pregnancy. And then I took just a vitamin, prenatal vitamin. And I think that was it from what I can remember. It wasn't I think towards the end of my pregnancy, I say the end before the C-section, I started taking a dose of prednisone to help with all the swelling I was having. But yeah, things escalated pretty quickly after that.
Yeah, it seems like that. It is hard just to kind of feel like you are the reason that all of this happened because of your condition. Like that must have taken such a big toll on your mental health. And I'm wondering like what are ways that you coped during that time or even afterwards to kind of make sure that you are not the person to blame. Like this is what life is.
Yeah, honestly, it was hard. It's very hard. And I think it's okay to accept that that's really hard. The things that kept me in that moment of time was being able to still enjoy seeing my daughter and watching her grow. I think that we always say that was our light. Like, after she was born, we had a lot of really dark times in my life, just not only with my health, but with other personal things that were happening. And Renee was always our light, and we had her to look at. And look forward to seeing. And then once she passed away, I mean, my world went dark. I was diagnosed with more stuff. I didn't know who I was as a person anymore. Everything I felt like was my fault. My husband, I couldn't work anymore. My husband was paying my medical bills for me. Like, I just felt so much guilt. It was really, really hard to get through that for a long period of time. And I relied a lot on, honestly, like the community of people out there. I never searched for people with, like Sjogren's or lupus or anything like that outside of outside of what I was feeling for myself. And then once I found that there were other people like me who had gone through similar things, that helped me feel more comfortable and confident, and knowing that, okay, this is something that can happen. It just so happened to me. It's not a lot of therapy, a lot of writing. I use writing as a coping skill, but it took me a long, long time. So I had to learn to give myself some grace. And I talked a lot to a lot of different people who also been through similar things.
I'm sorry for that. It's now your job to continue to raise awareness that things like this can happen so more mothers are aware. Can you talk a
Yeah.
little bit about the challenges faced by both sides? So, like, how should the future of healthcare be improved to satisfy both parties?
Yeah, absolutely. It's really hard. And I think I think it's why I can give doctors some more time and some more grace because I know it's difficult to navigate what healthcare looks like now. And, in my role as a PT, I don't prescribe things beyond exercise. I don't order labs, medications, things like that. So it's a little bit easier on my end, but there's so much pressure from insurance, and so much pressure from administrative people to meet quotas, to recommend certain, treatments before you get other ones. Like most people come to me, they have to come to me first before their pain management doctor will give them something else. Or there's just so many barriers and hurdles that you have to reach, to be able to give people treatment. And then there's also like doctors probably see somewhere like 40 to 50 patients in a day. So, and I know that's why I enjoy being a physical therapist because I don't see that many people and I get to spend much more time with them. And I think it's helpful for me to be able to spend that time with them and advocate for them as well to their doctors. If another medical professional is recommending something, then likely something needs to be done. But there's so many hurdles and red tape to cross to get treatment that you need. And doctors are probably overwhelmed. So I like to make sure people do not forget me. I will send them messages constantly. I will, keep my appointments with them all the time so they know. I will follow up if things fall through the cracks. Like I don't wait for them to schedule an appointment with me, or if it's been 3 months and I need labs, I'm messaging them and saying, "Hey, it's time for my labs." Like I try to stay on top of what I can do, for myself because I know in some cases, in some offices, I'm just a number to get through the day. And so it's really, really difficult to navigate that. And then there's so much, I mean, I could talk about this for an hour, but there's so much red tape you have to cross sometimes for doctors on their end to get treatment and to give treatment, unfortunately. But yeah, you are the only one that can help yourself at the end of the day. So you have to make sure that you feel comfortable with your voice being heard and not being afraid of advocating for yourself.
I wanted to end off the podcast episode with an advice segment. So, what would you say to those who are navigating a new diagnosis and really just trying to understand it?
Absolutely. Yeah, it's hard. First of all, it's hard. It's okay. It's okay that it's hard. There's no right way to do it. You just have to do the best that you can for yourself. You always just put yourself first. And it took me a really long time in my life to learn that. And, lean on support where you can. Find people that can listen to you, find things that bring you joy. This does not have to be your life. It can be a part of your life, but it doesn't have to consume your life. So don't forget to do the things that still bring you joy within your means, that you're able to. There's a huge community of us out here who are supporting each other. And I would love to say I have the biggest support system because I do, but there's still times it is so isolating. And there's nothing like hearing from other people that are going through similar things, or at least know what it's like to navigate the scary journey of a new diagnosis and what to do and what that may look like. There's no right or wrong way to do it. You just have to learn how to listen to your body and make sure that you do whatever you are capable of doing in that day and don't feel like you have to compete, compare, do anything different. You are an individual person and you just have to listen to your needs and what your body's telling you, and take a step back to really learn what that means.
Thank you so much, Emily, for coming on
Yeah.
this podcast episode, we talked about a lot of different topics, talking about diagnosis, medication, growing up with arthritis. We discussed how your condition impacted your career choice. And then we also talked about how to kind of navigate relationships with arthritis and the challenges you face pre and post pregnancy. We talked about sort of raising awareness and advocacy, and then how to also make sure that you have a good healthcare team that you can always rely on. Last but not least, we also talked about being a healthcare professional and a patient and how to navigate both of those lenses. So everyone, like, comment, subscribe, check out Emily's social media channels, which I will link down below. And I'll see everyone in 2 weeks on Take a Pain Check. Thank you so much, Emily. Bye.
Thank you, Natasha.
Keeping